Hi, this is Dan Endress, and I'm here to speak about healthcare associated debt and the problems we're seeing with this on the National Healthcare Scorecard. When we think about the great changes in healthcare, we continue to hear about improved insurance coverage and how insurance is helping to cover medical costs. Yet when people go and seek out healthcare, they are faced with many different challenges. As we look at the picture on this next slide, we see a man who's obviously ill. Do you believe he's worried about the outcomes or the cost of his medical insurance? Probably not. He just knows he's in need of desperate medical intervention and will do so despite the cost. Many people every day are not ill or injured enough in their own minds to seek out health care, as they fear financial burden that will come upon seeking out health care. With nearly 2 million people facing bankruptcy in 2013 as a result of medical bills, Mangan 2013, the citizens of the United States are questioning if and when they really should seek out health care. They often question how good their medical insurance is. They question whether their provider will accept their insurance. They question if they can really afford the copays or the deductibles that come along with the cost of health care. They often wonder, if I seek health care, what will occur? Will I be able to pay for this? What will be the results if I don't pay for my health insurance? More than 25 million people are skipping doses of medications, taking less medications, or delaying refilling their prescriptions in order to save money. And this is with health insurance. How is this impacting the health care of our nation? We may be seeing less debt as a result of health care, but it is the result of more health care problems coming forward. No one should be put in this position to wonder if they can afford seeking health care and if they need to count pennies to go to the doctor to get the medical care they deserve. It was reported by Cozen 2014 that nearly 40% of debt in the United States is related to health care. It was also reported 63% of Americans have received a medical bill that was more expensive than they expected. This same article points out the cost of one gastrointestinal bleed with the same services provided at two different healthcare facilities with a price difference of 54%. When people seek out healthcare, they don't ask for a price list or a menu. They go to the facility hoping to receive good quality care in order to return home. With some of this latest data showing that a majority of healthcare is causing the major debt we're seeing in this country, and that a lot of this debt may just be related to medical errors in their billing and hospital price discrepancies, what should we be doing as a nation? Healthcare should not cost more at one facility than it does at another. Healthcare should be equal no matter where we go. And right now we're seeing that this is not the truth. We're seeing that healthcare in one facility is double or 54 times percent greater than it is in others. So what's this showing? This is showing as indicator 34 on the national scorecard, looking at those adults 19 to 64 who have no medical bills or problems no medical bill problems or medical debt. In 2011, the scorecard reported that 60 was the average goal, with the goal of being 100%. What is that saying to us? It's saying that 40% of the people in this age group are seeing problems with medical bills or having problems paying medical bills or in debt as a result of medical bills. We may believe it's due to a lack of insurance or maybe the appropriate insurance coverage. But no matter what the cause, we need to be doing something about improving the national healthcare system. We need to look at ways to help decrease the number of people with debt related to medical problems or the people struggling to pay for bills related to medical care. A quick story, let's think about an average American citizen. Let's say the housekeeper who works in the local hospital making $12.50 an hour. Is this person working 36 hours a week with medical benefits at a cost of $125 every other week, making $900 before taxes. Now we say that they get injured and they need a ride to the hospital in an ambulance. Oh, wait, their medical insurance, they should be able to cover that. Oh, that has a $50 copay. Oh, wait, now they get to the hospital. Oh, $250 copay. Now they need to be admitted because they need surgery. Another $250 copay. Oh, we get them home now. Now they need 4 follow-up appointments. Oh, they're specialists, so let's say $40 for each one of those. Oh, another $160. Oh, now you need to see your primary care because you need a prescription refilled. Oh, $20 for your primary doctor. Oh, now we need to go get our prescription filled. Those are $10 each with a copay on our prescriptions, another $40. Now, we have this insurance and a person who's weighing up a numerous bill just in copays and deductibles related to their health insurance. Is this helping our national economy? Is this helping the people seek out health care? Are people able to be healthy and seek out health care early on and preventative measures if they can't afford to go pay copays and deductibles? Now that this person's been to the hospital and has all these copays and deductibles, how many times are we seeing results in medical bills that are not correct? Medical bills are showing that one study showed that 49% of Medicare claims in a small 34 hospital study had some sort of billing error, Glover 2014. What about the difference in billing between hospitals for the same test or procedure? How can one hospital charge 15 to 50% more than one just down the road? This was seen in the Bronx. It was reported that unpaid medical bills are lowering people's credit scores by 40 to 100 points, Kuzan 2014. Imagine the impact this has on our economy overall. When people are losing their homes, their investments due to healthcare debt, its impact on our entire economy. It's time Congress gets involved and starts looking at a single payer system to help save the American people and turn around our economy. In 2005, 34% of the U.S. population had a medical bill problem or outstanding debt, as reported by the Commonwealth Fund on the National Scorecard. In 2011, this increased by 6% to 40% of people with debt. Not only is healthcare debt increasing, so is the cost of healthcare premiums. Imagine you at home trying to live on a regular routine salary, and now your healthcare premiums have increased 159% in the last 10 years. Is this helping our economy? Is this helping our people with medical bills and medical coverage? What can we do to help solve these problems? Where's the answers? What can I do to help figure this out? Over the last couple of years, we've seen an increase in the number of investigations into fraud in the healthcare community. The Americans Affordable Care Act has helped put out different regulations and rules. It's put a limit on the amount of premiums used for administrative costs for insurance company. It allows young Americans to stay on their parental health insurance plans until age 26. It also has provided a tax credit for those who have health care. But are all these bills enough? What else can we do? Is our income outweighing our outgoing resources for medical bills? I don't know the answer to this, but I can tell you with a single payer source, we can look at improving how people seek out health care and how we can improve the health of our economy. Let's move forward. Let's stop allowing insurance companies to run up premiums and out-of-pocket costs for American people. Let's have healthcare insurance programs equal across the board for all Americans. Let's have a system that does not wipe out savings account and bankruptcy. Hospitals should not be causing people to go bankrupt. Just because a person goes to the hospital, they should not end up in debt or bankrupt for basic human needs and cares. Why, this may not be the possibility right here and today. So what can we do to help offset the cost of health insurance for people? While we wait for you to move on to this single payer source, we ask that you have a separate process for dealing with medical debt. Maybe a system that requires health insurance to put on a maximum on out-of-pocket expense based on income. Let's say you make 75 to 100,000 a year. Maybe you're responsible for $4,000 a year out of pocket. If you only make 39,000 or below, maybe a maximum of $2,000 a year. Maybe each child, maybe you should only have to spend $1,000 out of pocket a year to cover your expenses for a child. Whatever the answer is, we need to do something soon in order to help increase this number on our scorecard. Let's increase this so no American has any medical debt or problems related to a medical bill moving forward. So in 2020, we should be able to see 100% on this scorecard. Thank you for your time.